I love surfing. I feel happy when I'm surfing.
Sam Stubbs lives an active life. When the 27-year-old isn't at the beach, he's at his local gym.
I'm pretty fit. Soon I'm competing in Gold Coast in CrossFit Games.
So when Sam got sick in 2025, his parents were shocked by the way doctors spoke about him.
We were obviously trying to work out what treatment was going to be needed, and then they asked us what was his quality of life.
It dawned on them they were being asked this because Sam was born with Down syndrome.
It was almost like we had to present a resume to prove that, yeah, this person has a really great quality of life. Please do everything you can.
In the 12 years Sam has worked at his local bakery on the New South Wales South Coast, he's rarely taken a sick day.
I'm good.
So his colleagues knew something was seriously wrong when he was away for several weeks. Sam had picked up a respiratory infection while on holiday with his family. When it didn't clear up, he went to the doctor.
We were told his temperature was well over 40, but because he was still walking around, which is what Sam does, I think it was probably dismissed. We weren't actually given any kind of medication or follow-up.
Then, when his condition rapidly deteriorated, his parents rushed him to their local emergency department. He was quickly transferred to St George Hospital, where they discovered he had a collapsed lung and several lung abscesses.
What keeps me awake at night is thinking, if we weren't there, what would have happened?
People with intellectual disability in Australia are a group who experience one of the greatest health inequities of any population group.
People with intellectual disability are twice as likely to suffer a preventable death. Research shows 38% of deaths could have been avoided with better healthcare. For the rest of the population, it's 17%.
A repeated pattern I've seen is that clinicians misinterpret symptoms expressed by a person with disability.
The Disability Royal Commission held multiple hearings on the treatment of people with intellectual disability in the health system, hearing stories of neglect from parents.
Joshy spent the night crawling around the bed in excruciating pain. The doctors refused to listen to me.
He said, "Oh, look, she has Down syndrome. How hard are you going to try?" I felt like I'd been punched in the gut.
As a result, the health department committed to valuing and respecting people with intellectual disability.
There are some simple things that we can do to make a big difference. One of those is to train all our future healthcare professionals and our current healthcare professionals with the skills and knowledge they need to make those reasonable adjustments in healthcare.
Okay, over to you.
Okay.
Down Syndrome Australia runs a training course to do just that, the Health Ambassadors Program.
Speak to me, not my support person.
Emily Porter is one of the program's 10 ambassadors, along with her colleague Amelia.
I am a grown woman and I want to be a part of making decisions.
One of the most powerful things about this program is that it does centre the person with intellectual disability as part of the solution. They are the expert in this space.
Thank you. Thank you very much. I really like your story.
The Department of Health wrote to Down Syndrome Australia in February, saying it would not continue funding the program beyond June 30, 2026.
Would you like some tea?
I spent an afternoon with Emily to find out what healthcare professionals will miss out on if she loses her job.
I think it really is important to respect me as a person with a disability. I don't know where you put it. I don't know where you...
She recently celebrated 14 years of marriage.
I've been a show off. Mark and I really love being together because we're like magnets. We can't let go from each other.
When she talks to medical professionals, she tells them about a time she went to hospital and was not allowed to have her husband with her. How does that make you feel?
Nervous. And sometimes I like holding my husband's hands. I always dig that. Oh yes, it's right there.
She wants medical professionals to make adjustments to help their patients feel comfortable and included.
My Bobby, so I'm not nervous.
It's a lesson we learnt when filming with Emily as well. We set up a formal, typical interview with bright lights, unusual equipment, and it was creating an environment that, much like hospitals, wasn't putting anyone at ease.
I had bad experience with health workers not listening to me.
It wasn't the best way to help Emily express herself.
Do you want to take a break, Em?
No, I'm fine. I just want to hold my husband's hand.
And then just go for it.
But in a more relaxed environment, she could explain why doctors should centre her in discussions about her healthcare.
I am the patient.
They should be talking to you, shouldn't they?
Yeah, they may be talking to me.
The government now says it's considering extending the funding for 12 months. It costs about $350,000 to run. The government has also spent $4.7 million on developing training materials. Advocates say they are not being used.
All the know-how to train and equip current and future health professionals is there. We now need this mandated.
Yes, Austin.
New South Wales Health said its staff are trained to respectfully work with patients with disability, but acknowledged there is always room for improvement. Sam has fully recovered. His parents acknowledge there are good medical professionals out there. They don't think they should have to tell doctors, but want them to know this.
I'm happy because I got a good life.